Hello, everybody, and welcome to Human Caring. Today, I have the pleasure to talk with my old colleague, the clinical psychologist Mette Schubell, Mette Sofie Schubell. Welcome, Mette.
Thank you. Thank you for inviting me.
Mette, you are a clinical psychologist and which is working in the Sexological Clinic in the hospital in Copenhagen. You also a trauma-informed yoga teacher, and you are in the middle of your education as a mindfulness-based stress reduction teacher, correct?
Yes.
Yes. So, I don't know, I think we'll start, as usual, from one place and see where it's going to take us.
Yeah.
So, I was curious to hear what is it that attracted you to the field of embodiment of yoga and mindfulness?
Well, I think it started probably already when I was studying at the university. I was very interested in kind of the at university they called it kind of the area where body and psyche kind of overlaps, and as I've come to learn, that doesn't really make sense. That's a very dualistic way of seeing the body and the mind, but that's where it started. So the education at university is very theoretical. So I wrote some papers on different topics, such as like how does the body image change when you go through cancer treatment, and how can you incorporate the body in treatment of women who've been in relationships where there were domestic violence. So it was kind of a very theoretical interest to begin with. But then when I started working as a clinical psychologist, I was really what I noticed was that a lot of the people I was talking to either had this very was very much mentalizing about what their problems, what was going on, trying to understand why am I feeling this way, but not really feeling anything in their bodies. When I asked, so how does that feel in your body? Do you feel it anywhere? It was very difficult for them to say anything about the body. It was all like, I think and I feel. And for others, it was more not being able to say anything about why is this happening or what am I experiencing, but their body was reacting quite dramatically, and it was very they were in a lot of suffering because they wanted to understand what was going on, and very much the impulse to control the body, like this was something unwanted the body was doing on its own. So I became very interested in how would it be if we could see all these things that the body is doing as something the body is trying to tell us there's something going on, to use that wisdom that the body has to understand maybe something in their life that was not good for them, or all these people with stress reactions or anxiety, like maybe if we see it not as something we need to get rid of, but something that is very helpful information. So that was kind of the way in for me. And then when it comes to yoga, I've practiced yoga on and off for many years, but more consistently after I had children. So about 6-7 years, and noticing what a regular physical practice, kind of the effect that had, and becoming interested in kind of the more experience-based, I guess you could say, part of it more than the theoretical. So the yoga teacher training that I did is very much going in through experience and trying to let go of the need to understand what it is we're doing and what is it that I'm experiencing, kind of just being in the experience. So I'm very much kind of on a path still. Don't really have any conclusions or answers as to how this is going to what it's going to look like in my professional life, or I'm just kind of exploring. And through the yoga teacher training, I got into a more regular meditation practice. And then because we use a lot of mindfulness-based interventions at the clinic, that's kind of the way that led me to the education that I'm doing now with the mindfulness-based stress reduction. Yeah.
It's beautifully put, that you tell that you're on your own path. And, while you were talking, I could hear that your experience of your own education at university happened a lot in the head and with explanation and the need to describe and formulate some processes that actually are needed to be experienced. And at the same time, people come to your clinic and they describe the same kind of process where they have to put a name or to try to explain and to understand what's going on in them through the head. And I think it's beautifully put when you said that once you had your own regular practice and you start to see the experiential part of it and what happened of the need to explain, how it's kind of helping somehow integrating the head and the body somehow. So do you experience, or do you feel that your experience with your own practice, with your own education, with embodiment practices, help your patient when they come to you? Does it help you at your work as a psychologist? Do you integrate it?
Yes, I think where I'm at the moment is very much being more trusting of what I am sensing and experiencing in the conversation when it comes to body language, and also kind of when I sense something in my body that I feel relates to what the patient is talking about, to have the I don't know if it's confidence, but to be able to ask, when you talk about this, I get this sensation. Is that something that resonates with you, or can you relate to this? So when you experience this sensation in your body, what does that feel like for you? And kind of, I see it sometimes as kind of when you have little children, for instance, it's very much in the educational or developmental psychology that you kind of mirror their emotions, so they don't have a language to say, oh, I'm sad or I'm angry. So the little children, you say, oh, okay, now you're crying, you're upset because you wanted to play with a toy or something. You kind of help them put words to what they're experiencing. And I feel it's kind of the same thing to say, okay, I get this kind of feeling in my body. Is that maybe something you experience too? So in that way, facilitating or helping them maybe notice things that are going on in the body.
That's very interesting. I remember in my education as a therapist, then we had a very, repeatedly saying to meet the people where they are, to meet the person you're sitting in front and to relate to what you meet. And I always, ask myself what that means. And I think the process you describe with having your own practice of slowly realizing that we can become aware of what's going on inside us while we are sitting with somebody else. And that's information that is so valuable, because I cannot see another person unless I see myself, because we are communicating constantly. And we know that most of communication is nonverbal. So unless I'm tuned with my attention inside myself while I'm tuned to you, then I can miss you and you can miss me. And so it seems like your practice kind of brought you to see that your body is a tool for you to meet another person, source of information. Yeah.
Yes, and it's very important what you say about meeting the person where they are, because it's not all patients it would make sense to say I'm getting this sensation when you're talking about this. For some it would be more asking, so when you're telling me about this, what do you have any sensations in your stomach, for instance, or like kind of pointing them to notice if there's anything to notice, specific places in the body. And for others where they do feel more things in the body, it would be more to ask this way, okay, so for a moment, if we imagine that this is your body trying to tell you something, what do you think it's trying to say? So kind of in that way, trying to connect the thought with the experience in the body, or the emotion with the experience in the body.
I think it's very important as a professional that work with people. I mean, I'm convinced that no matter what kind of therapy or we go to, if it's talking therapy or body or whatever, somehow there is a process of trying to be aware of that which we are not aware, because part of the problem is what we're not seeing, our patterns and what the process is going on in specific situations. So it sounds like it's a great capacity for a therapist or a professional to use the situation one is in together with the client or the patient in order to relate to the facts that in the body, and see how little we are used to do that, but how much it will help us in order to understand maybe the context of a different problem. And won't you agree about that?
Yes, definitely. I think that's very much part of it, and for me also to try and help the person to have as many different resources to draw information from, so that it's not just thinking about something or feeling about something. That's usually, like we say, I'm gonna have to think about it, and then I see some people are more like using like their emotions, or I feel that this is the right thing to do, and kind of to get all the things together. I don't think there's one part that's more true or right, or I don't know, has the ultimate truth, but like everything is something that we can use as information about what is going on right now, if that makes sense.
Makes a lot of sense. And it's interesting you start talking about university. In a way, we are not trained to pay attention. We are trained to remember and to memorize and to quote other wise people, and that knowledge we confuse as understanding about what's going on in me and outside of me and the relationship that occur. So it seems to me that, from my own experience, that those embodiment practices are really a tool to kind of, it's like a muscle training. It's to train a capacity to be aware, with other words, to see. And as you described, we begin to see that in every moment there is a lot of sources of information that together can give us a whole picture, right?
Exactly.
Yeah. So how do you, I mean, as a psychologist, I guess, I don't know, I'm not a psychologist, it's a lot of talking about what's going on and explanation. So how would you help people to to pay attention?
Mm-hmm. Well, it's very much to kind of well, of course it varies. It depends on the person, but for a lot of people in general, I feel like it's a question of slowing down. So when they're like talking, or there's so much going on, to kind of really get into the details, so that you stop for a moment. And I think that's a very big part of mindfulness training. Also, is kind of to stop once in a while, to notice. You have to slow down and stop doing so much all the time. You have to more, I don't know, that's kind of a cliche. So do less and be more. So you have to be more to notice. You have to have time to notice. You have to create the space where it's possible to notice. So that's a big part of it, I think, in therapy. Also to kind of guide the conversation to certain points of investigation. And usually that is, or I think that should always be in cooperation with the person you're talking to. So you have some kind of contract. What is it that they are here to explore, or they are here to work on? But then to kind of, when you guide the conversation, you don't always know exactly the purpose of it and how it relates to what the contract is that you're working on. But in my experience, often when we pause and investigate a little bit more, everything is connected. So it can always relate to everything else that's going on with that person.
That's fascinating, because I remember it clearly with my experience as therapist that there is a big challenge there when people come in general in our culture, where we have a problem or some challenges in our life. We want a solution. We want to come away from it. We're in A and we want to go to B, and so
as fast as possible.
Exactly, and as less effort as possible. Hopefully the other person will fix you, as a therapist. And what you're talking about is actually inviting people to stay where they are and to just become curious of the facts that appear in them. And you try to guide them in order to be a little bit more curious, a little bit less judgmental, and perhaps a little bit less holding on to any kind of an end result. And you were talking about being. And so I'm curious, what is the role of your own practice, the being practice, if it's through yoga or mindfulness, and how does it contribute to your role as a psychologist or a therapist in that room? How important is your own practice to that?
It's very important, I think. It's very clear to me when I have periods of time where I, for some reason, practice less. It's very immediate, the effect I feel it has when I'm in session with patients, that I'm less present and less what's the word, kind of, I miss more things. Like when they talk, I miss more points of entry into this investigation, and I get, it's much more likely that I also get sucked into the, okay, let's fix this, fixing, okay, I need to fix their problem, or they're coming to me for some kind of cure, I need to provide that. So the more I have my own practice, the more I can be at ease with trusting that being present with what is and investigating and being curious is what will facilitate the change that they're looking for, hopefully.
That's beautiful. So I know you're facilitating mindfulness groups and you have individual patients. Do you have any advice for other therapists, or advices about being a facilitator? I mean, you named some of it just before. What would you, how would you advise others that are trying to take this role?
Well, I think the practice is very much the key, your own practice, but also to start practicing facilitating for others is very important. I did this with the trauma sensitive yoga training that I did. I just practiced on family and friends for a long time because it has very specific language and wording and ways to formulate the invitations, not the instructions, but the invitations to movement. And that was very foreign. So practicing. And with the mindfulness, in my experience, it's very much also kind of being in my own practice when I'm facilitating. So that's more of a double, but being very present and available for the people that I'm facilitating for, but at the same time noticing, okay, so how am I gonna phrase this? Okay, in my body I experience it like this, so I'm gonna see maybe, and all of it being invitations to, maybe you can sense this, maybe you can sense something like this, or maybe it feels more this way, or maybe you don't feel anything at all, and that's what's present right now. So when you have a continuous practice, you will have experienced a lot of different sensations in the body, and sometimes not sensing so much, and so the experience that all of it is possible, I guess.
It sounds to me like you're really talking about being authentic, and
yes,
and it's a must condition when we try to invite people, because we are also people, and it doesn't matter if we're therapists or not. I mean, how can we relate to other people if we do not authentically relate to ourselves with the tools that now we learn in specific traditions? And that's very important. And I think another thing you said, which I can recognize, that in the beginning when you facilitate, then you try to find the words that you learn, and slowly you kind of, the more authentic you are, the more you kind of letting go of what you learn in order to find your own just way of doing it and trusting it. Yes. Isn't it?
Yes, yeah, exactly. And I think the authentic part is a very accurate word. That is maybe the most important thing, that if you're facilitating using someone else's words or ways of doing it, or trying to do it like they are doing it, it will feel a little bit like a shirt that's a little too tight, doesn't really fit, or it's okay, but it's a little bit off somehow. At least that's the way I experience it. I get more in my head and less in my body, and I like to be both places if possible.
It's I think it's very important what you're saying, and it's interesting that we started off talking on your education from the university, which a lot is going on in the head, and trying to use other people's word theory and models. And it seems like you in your path you stumbled upon this thing that your own experience, your own being authentic in your own practice have also importance. And it's about the balance, right? So you are working in the established healthcare system. Do you think that there is more need to integrate those two words, like the embodiment process, the experiential, the authentic work with one attention and body, and the traditional talking psychologist, or to combine those two words? Is there a need for it?
Yes, I think there is. I think we can gain a lot from it. I think there will always be someone who will more seek the traditional medical solutions, and that's fine. I mean, patients who come to the clinic, for instance, hoping to get some kind of pill that will help with this, and not really being interested in exploring what lies underneath the symptom that they're experiencing. And that's fine. That's where they are, and if that helps them, that's fine. As well as I think there are people who are more likely to seek out treatments that are more body focused and kind of don't see themselves getting any help from the more established medical system. And I think that's fine also. But I think there's a lot of people where it would really be helpful to integrate the two, just to have the experience that it's a holistic view. I think that's so important, to move away from the very dualistic view of the mind and the body, or the established evidence-based healthcare system, and the more I don't know, some would call it more alternative, but more maybe more based on experience of what seems to be helpful.
I mean, it's not a new process. It's a process that it's been going on for many years by now. And I think it's still interesting that there is, I mean, as well as while we're talking, it's still the same words coming out of our mouths about something that was more evidence-based and something more alternative, which in reality, that's not true. We know that research and brains research and the hardcore science show us more and more how there is actually no separation. It's a little bit more traditional way of seeing things, and the modern science actually showing us that yes, if you're working with your attention on your breath, on your body awareness, and you learn to accept, and you learn to kind of build a certain resilience that helps you to contain the challenge in your life, and you can grow out of it. It's actually changing the plasticity of your brain, and so on and so on. Now there is a challenge because, like in medicine, it's not 100%. It's like for some, as you said, something else are more helpful than others. So what do you see is the challenge in integrating more those two? I mean, I know it's been a lot done. There is integration, but I feel like we kind of, it's very slow progress. What are the challenges?
Well, I also feel like it is happening. It is a process that has been going on for quite a while also. And what I experienced when I started my current education as an MBSR instructor is that for some it was so important they actually chose this education because this is an evidence-based program. I can trust that this is helpful. And then I think when you dive more into what it actually is, what you're doing, what you're practicing, then hopefully that will I don't know if that will shift, but it's definitely inviting more people in who would never have sat down to meditate otherwise. And I think that is how making something evidence-based can be helpful. So I think it's good. There's more and more research, but the challenge is to, I think, the discourses around it, like being more alternative. I mean, what is that even? Alternative how? It's just this separation still. I think that's just the challenge, to see one kind of treatment as the more established, and another kind of treatment as something alternative. I mean, in the medical healthcare system, they try new treatments all the time, like without, I mean, it doesn't get evidence-based without trying it out. So there's a lot of treatment going on in the healthcare system that is not I mean, it's not like it's experimental. Of course, there are trials and all this, so it's not, but like evidence-based, I think we need to look at maybe what does that even mean? Like, because sometimes things are talked about as evidence-based when there's been done 3 studies and they kind of showed maybe a tendency towards this. So it's very important to be aware of that, and I think that's doctors of course very aware of that. They're trained in research and science and all this, but for the general population, I think there's something very seductive about the evidence-based claim that is not really founded.
It's ring of authority in a way. We love authority somehow.
Yes.
But I think it's also important that we, you talk about doctor, it seems like you refer to the somatic area, and I know the big part of health, I mean, it's open up to the question what health is. And especially when we talk about psychiatry, when we talk about exactly this kind of, it's not a black and white separation, body and thoughts and emotion. I mean, as an organism, that everything as a system that connected with different functions and connected to the world outside. It seems like it's necessary to expand our understanding and realize how they work together, and how we can learn to help people to take responsibility on their own health, and what does it mean to take responsibility on one's own health, and how the professionals, the authorities, psychologists and doctors and different therapists at the kind of become an authority that empower people to become their own authority and to invest in their own well-being, both as a prevention and as understanding of what does it mean to be a living organism and to deal with life, which is up and down. It's a very fascinating process.
Yeah. And I think there's a lot of definitely psychologists, therapists, doctors also who are very aware of looking at more the whole picture. But then the whole healthcare system is built that it's very, okay, do you have a problem with your knee? You go here. Do you have a problem with your heart? You go here. Do you have a problem with anxiety? You go here. So it's in that way very divided. So the healthcare system is a difficult place, I think, to practice the I don't know, practice holistically or kind of treat holistically, because then it'll be, okay, we treat this part here, but we see that this is connected to something, but then you have to go here to talk to someone else. And of course, that's in some ways necessary because people have different specialties that they know a lot about. But I think that's a real challenge also, to have more, I don't know the word in English, but more different professions working together. That's one of the strengths, I think, in the Sexological Clinic, that we do have different kind of yes, exactly.
And I think that's my hope, that, you know, we can overcome those challenges by exactly connecting, communicating, and collaborating, sharing knowledge, and accepting kind of to expand our own understanding. And it's not always easy. And I think it's not only healthcare system, it's basically all our social system, it's school system, workplaces. How can we, in a way, share our knowledge and kind of find implication to the cutting edge research and technology in order to kind of really reopen our way of seeing human being and the different potential of developing health and well-being.
Yeah.
Is there anything else, Mette, that you want to talk about or to add before we are wrapping it up?
No, just that it's, I think it's very interesting, very exciting to be in this kind of exploration of how can we use more of our resources, how can we gather more information also in when treating patients, or and just in, as you say, in general, in society in general. I think that's very for a lot of people, things move so fast, so they don't have the chance to really think about these things, I guess. And that's also I think interesting with these talks that you're doing, to ask people to kind of consider some of these things.
And somehow, you know, it seems like we have a collective stop with the present situation. And you know, I know it's a very challenging time because it's bringing a lot of insecurity and a lot of challenges and fear. But at the same time, you know, it gives us this kind of interval of kind of, okay, this is where we are. There is a necessity. There is more and more separation going on, and more nervous system that going into a flight or fight or freezing. And we have a kind of a necessity to communicate and to support what I hear you calling a certain, there's a movement going on. And I hope that the way I see it, that each one of us can only take responsibility on oneself and work seriously with that. And I'm pretty sure that we can inspire and connect with each other with it.
Yeah, hopefully.
Thank you so much, Mette. It was a pleasure seeing you again and talking with you.
Yeah, you too.
So till the next time, thank you.
Thank you.
Bye-bye.
Bye.